I'm very excited to be here today to discuss current brain research and our brain-based approach to helping kids who struggle with attention, impulsivity, distractibility, behavior, socialization. I'm really here to give you answers as to why we're facing the largest epidemic of neurobehavioral disorders in history. Tonight, I speak to you not only as a clinician, but also as a parent of a child who struggled in many of these areas. I know it's very frustrating when your child can't keep up with the rest of the class, when a half an hour of homework turns into 3 hours because your son can't sit still or is distracted by everything around him. It's frustrating to hear your daughter tell you she hates school and starts to develop low self-esteem, and you have to walk around on eggshells because you don't know what you're going to say that might set off your child to go into a rage or a tantrum. And at the same time, it's very, very frustrating when your child looks up at you and tells you, I'm stupid, or I'm dumb, or I wish I was never born. You know, most of our kids hold it together all day long and take it out on you when you get home. So what we're going to discuss today is really what's going on in the brain that are causing these problems and why these changes have occurred, and how this particular program can change the brain on a long-term basis. So a little bit about myself. I've been researching the brain over the last 20 years. I'm a chiropractic neurologist I'm a fellow of the American College of Functional Neurology. I do specialize in childhood neurobehavioral disorders. I'm actually one of the pioneers in this program, but most importantly, I'm a parent. So my son actually spoke very early, spoke around 8 months old. His vocabulary was very advanced, but he would get very irritable at times. Certain clothing would bother him, a tag on his shirt, if the seam in the sock wasn't the right way. He had difficulty with kids his own age, social issues. He got along much better with adults. He had trouble with team sports, organization, attention, focus. So I really witnessed firsthand the inability of doctors and the school system to give me answers. So that's why I spent the last 20 years researching the brain, and I found a system that I'm going to discuss today that makes the most sense and gets to the underlying cause of these issues, because once you know the underlying cause, you can fix the problem. So the answers I want to give you today is really, what is this program? Where's the research behind it? And are there any published outcome studies on this work? Well, the Brain Balance program, we work with kids who struggle with behavior, academics, socialization, attention, based on an imbalance in brain development, based on the way the brain is maturing and connecting and coordinating, that there are overdeveloped hemispheres of the brain and underdeveloped hemispheres of the brain. And what our goal is to really improve connectivity, coherence, and maturity in the brain. So it's very, very difficult to give a diagnosis to these issues because our children have symptoms in all these different areas. And what we really call this is a functional disconnection syndrome, that functionally systems in the brain are not connecting or communicating appropriately. So why do we focus on these imbalances? Because it's an epidemic. A lot of our children are diagnosed with certain issues, some are not diagnosed. So our goal is not really to diagnose the child, but to really see what's impacting the brain that's not allowing them to reach their potential from the perspective of attention, concentration, organization, time management, social issues. You know, many times parents will tell me that the teachers know something wrong, but they can't put their finger on it, that only if the child tried harder. So when you look at it from a brain perspective, we don't have to give a label to these issues. And to tell you the truth, about 25% of the childhood population is diagnosed with some form of disorder, but there's another 25% that's not diagnosed. So that's 50% of our childhood population has some form of neurodevelopmental imbalance. And this is increasing dramatically. 11 to 15% of children have been diagnosed with attention deficit disorder. 15% of our childhood population has dyslexia or a learning disability, 2% an autism spectrum disorder. This totals about 25% of our childhood population. And again, those are the children that have been diagnosed. 14 million children have some form of neurodevelopmental disorder. ADHD is the #1 reason a child would visit their doctor today. 1 in 7 children are diagnosed with attention deficit disorder. It's the most misdiagnosed condition in America today. And it's a very superficial, simplistic diagnosis because it's not just an attention problem. It's an inability of the brain to coordinate and mature in an appropriate way. If you look at the statistics, in the 1970s, about 150,000 children were taking methylphenidate, which is Ritalin. Today, 10 million children are prescribed stimulants for attention deficit disorder. Children in the United States consume 3 times the quantity of stimulants than the rest of the world's children combined. That's a staggering statistic. But when you look at the long-term efficacy of stimulant medication, this is based on the National Institute of Mental Health multimodal treatment study on ADHD. The long-term efficacy of stimulant medication has not been demonstrated for any domain of child functioning. So there is no chemical imbalance in the brain. There's a connectivity imbalance. And there's been many studies to show this. The American Pediatric Association textbook of neuropsychiatry states efforts to identify a neurochemical imbalance in ADHD children have been disappointing. Dopamine dysfunction is not the cause of ADHD. Dopamine is the chemical that's increased with stimulant medication. This came out of Cambridge University in the journal Brain. A study which comprised 4,000 children over 11 years in Quebec came to the result that those that took medication actually performed worse in school than those with similar numbers of symptoms who didn't use medication. Peter Jensen, who headed up the follow-up study on the multimodal treatment study for ADHD, stated medication use was a significant marker not of beneficial outcome, but of deterioration. And research into the use of antidepressants, which are called SSRIs, selective serotonin reuptake inhibitors. This was published in The Lancet, which is one of the most prestigious journals in medicine, stated that research into the SSRI use in children in childhood depression is one of confusion, manipulation, and institutional failure. But when we look at the current research and see what's happening is that it's not a chemical imbalance, but it's a connectivity imbalance. That areas of the brain are not communicating or coordinating appropriately. This is just 3 of hundreds of different studies. Altered connectivity in the brain is common across developmental deficits involving sensory, attention, and emotional functioning. Journal of Clinical Child and Adolescent Psychology. Functional connectivity of neuromotor networks is disrupted in children with developmental coordination disorder and ADHD. Abnormal functional connectivity in children with attention deficit hyperactivity disorder. So we understand now that the issue is a lack of communication and connectivity and maturity in the brain. Dr. Richard Davidson, PhD and MD, heads up the functional MRI clinic in Wisconsin University, calls it a lack of connectivity, that there are differences in specific circuits in the brain, and that treatment must not be directed at chemical intervention that is not specific, but with ways of utilizing specific environmental and cognitive stimulation that's targeted towards specific circuits. That is the basis of this program. Sebastian Sun, who's a professor of computational neuroscience at MIT, calls it a connectopathy, meaning that there's a problem with connectivity in the brain. So in order for any child to be successful, we need all the great parts of their brain to communicate, coordinate, and connect seamlessly throughout the day, because the right hemisphere and the left hemisphere of the brain are completely different. The left side is more of the literal, concrete, black and white, logical, analytical, memorization, reading, writing, obsessive part of the brain, the routine-driven part of the brain. We call it the IQ. The right brain is more of the social, emotional, behavioral, personal space, nonverbal, picking up on people's body language, eye contact, inflections in voice, more of the social hemisphere, the emotional brain. But what we see is there's an imbalance in that one hemisphere of the brain starts to mature at a faster rate. The other hemisphere does not catch up, and there becomes a lack of connectivity. And this causes an unevenness in skills, and it affects learning, academics, behavior, social skills, self-esteem, attention. So when we look at these imbalances, we could make these lists. A child doesn't have to have everything on a list, but typically we could see these specific symptoms when we see these imbalances. The left brain child might be more of a learning disability, poor at decoding, reading, dysfluency, dyscalculia, writing, memorization, but very good possibly in sports, has a lot of friends. Conversely, the right hemisphere, you would see a child more possibly with social issues, awkward, clumsy, doesn't pick up on body language, eye contact, inflections in voice, might be a good decoder, but making inferences, implied reasoning, cause and effect thinking would be affected. Personal space issues, doesn't understand their own body in space, space invader. So the goal is to get the whole brain to coordinate like a finely tuned orchestra. You could have 100 musicians on stage. If 10, 20 of them are playing at the wrong time, the wrong speed, the wrong tempo, that music's not going to sound too good. So you want to get all these billions of neurons making trillions of connections to start firing and wiring at the right time. So we do not want to stimulate the already stronger hemisphere of the brain. We want to stimulate the weaker hemisphere. But we want to do it using natural environmental stimulation. Smell, auditory stimulation, visual stimulation, balance, coordination, timing in the brain, cognitive stimulation, to build that weaker hemisphere up so both could reconnect. And we want to do this from the bottom up, meaning that the brain develops in stages from birth, and then each foundational system is built one on top of the other. So we have to look at these systems: primitive reflexes, sensory motor systems, body awareness systems, processing systems, with the goal of improving synchronization in the brain. This is a bottom-up approach. A top-down approach would be, let's use an IEP or a 504 or medication or psychotherapy. There's nothing wrong with those things, but the goal is to have the child be functionally capable of benefiting from these types of interventions. So we do a very, very comprehensive assessment, looking at many, many, many different brain systems. We look at primitive reflexes, which are baby reflexes. All babies have them, but should all be gone by 1 year of age. We need to look at how children are processing sensory information through the eyes, through the ears, through the skin, through the body, motor skills, cognitive skills. And based on the imbalances in stamina and endurance, we form an individualized program. So again, the goal is to get these children to the top of this developmental staircase, improve frustration tolerance, coping strategies, self-esteem, attention, focus, organizational skills, processing skills. But you can't get to the top of this developmental staircase until you've gone back as far as you can in development and seen where the roadblocks were. And that is the basis of the assessment. And it requires stimulating the brain exactly in an appropriate way, have it be progressively challenging with precise timing. This is the basis of neuroplasticity. Michael Merzenich, who's the father of neuroplasticity, this is based on his work, and this is the basis of our program. So when we look at the nervous system and we look at the brain, we realize there are billions of neurons making trillions of connections. A nerve is like a tree. You could have a tree with a lot of thick branches and roots, the one on the left, or you could have a tree with very few branches and roots. This nerve on the right can't receive and send information appropriately. The nerve on the left can receive and send information. This nerve on the right gets very overwhelmed easily, and these two neurons can't even connect. So the beauty of the nervous system is by stimulating these nerves appropriately, they actually grow more branches. So these actual branches can actually grow and improve and get stronger. And this is the basis of neuroplasticity. And now these two neurons could form connections. And that's the basis of our work. So correction is absolutely possible. It requires a multimodal program using sensory stimulation, motor stimulation, cognitive stimulation, timing in the brain, stimulating that weaker hemisphere, that getting both hemispheres to link up. Typical programs are 3 to 6 months, and the goal is to improve functional coordination between both sides of the brain on a long-term basis. So the way the program works is an assessment is performed, results are reviewed with parents. If we move forward, we have a welcome meeting where we go through all the guidelines of our program, which include nutritional support. You're teamed up with a registered dietitian who works with you. Child would come in for 1-hour sessions in our center or virtually. We have a virtual program. We have a hybrid program. Due to COVID, we have a lot of different ways that we work with children now. There are exercises to do at home. We have progress reports where we meet with parents every 12 sessions. I speak to school systems and explain these underlying issues. We reassess the child after the end of the program. And then we follow up. So every month I call parents and we follow up, see how things are going, and they come back 12 months later and do another assessment. And children who are coming back 12 months later are actually doing better than when they finished the program, because the goal is to give these kids access to parts of their brain they're not able to use right now. As far as the research that has gone into this, right now there's ongoing research by McLean Hospital and Harvard. An initial study was published by Harvard University. Dr. Martin Teicher, who heads up the Department of Biopsychiatry, did a home version of this program and found that there were profound changes in children with attention deficit disorder doing this program using many instruments that he uses. And he specifically stated the degree of improvement was not previously observed in children unless they were receiving medication, and only if that medication was the correct medication at the optimal dose. Another study was done in 2010 showing after 12 weeks of this specific intervention, 82% of children diagnosed with ADHD were no longer considered to be demonstrating ADHD, and this was based on the Brown's ADD scale. There's also supporting documentation through Cambridge Brain Sciences, through Dr. Adrian Owens. These are more cognitive types of assessments, executive functioning assessments, showing that after students go through this program, there was statistically significant improvements in 11 of the 12 cognitive types of assessments that were done with these children. So the question is that I always ask parents is, where do you see your child 3 to 6 months from now? If you see them happier, more confident, performing better in the classroom, that's great. But if you can continue to see them being overwhelmed, struggling, developing low self-esteem, then it's time to intervene. So if what I say today makes sense, if it's resonated with you, if you have a gut feeling that what you've heard here makes sense to you, then it would make sense to have your child assessed to give you answers. So what we're doing here today is we're offering a special seminar price of $95 for an assessment. It takes about an hour and a half. We meet and go over the results at a later date, or some parents would rather come in for a complimentary consultation and a tour. Either way, at least give yourself answers and get answers for your child. If you want to look further, you could go to our website, brainbalancenorwalk.com. You could telephone us at 203-286-7428, or you could email at norwalk@brainbalancecenters.com. Thank you for listening today, and if any of you have any questions, you could email me or give us a call. Have a great day.